2 patients are in stable condition. 7 patients are in, or 9 patients are in critical condition, and 3 of those patients are really in a life-threatening predicament right now. We took 7 patients to the operating room today. They underwent a number of procedures by a number of different specialists, and it's expected that over the course of the next several days, we will need to do ongoing procedures on many of these patients. I think the community of El Paso should be very proud of the trauma system that is here on their behalf to take care of them. I'm extremely grateful for the commitment by HCA Healthcare to have a level 2 trauma center here to be able to take care of patients in times like this, and I'm very proud to be a part of that team. I'll turn you over back to David for any further questions.
Thank you, Dr. Flaherty. Happy to take a couple questions.
Do you know how many doctors, physicians, nurses were called in or came in today to help with
I don't have exact numbers, but a significant number. I mean, we had many surgical specialists, general surgeons, trauma surgeons, orthopedic surgeons, urologists, anesthesiologists. A number of doctors ended up coming in to be able to participate in the care of these patients. We had staff from our hospital here, Del Sol, as well as our sister facility, Las Palmas, that ended up coming over as well.
Mr. Shamp, when I came here earlier in the day, I saw multiple police officers coming in through the doors. Some were specialty police officers with weapons and such. Is there a threat to the hospital, or is there any type of threat in the area?
I don't. We wanted to obviously to make sure that the hospital and grounds and everything were safe. It's a precaution that we end up taking. I don't know that there were any other threats, and I frankly can't really comment on that.
Can you talk about the ages of the children?
We didn't actually end up getting any of the children here, and so I can't speak to that.
If somebody could please clarify what stable condition means. I know earlier you said that there were some people who were in serious condition but stable. Does that mean that they might still make it through, or what does it mean?
Stable condition is that there is no immediate threat to life at this point. Critical condition is just that, critical.
And all the patients were gunshot wound patients?
I'm not entirely certain.
Kind of piggybacking off of that, gunshot wounds, I assume bullets were removed. Could you tell what kind of caliber, if there were bullets removed from any of the victims?
I don't know, and I'm not certain.
Can you touch on the teamwork of your team, how they all came together today to help?
Absolutely. You know, the unfortunate reality is this is the world that we live in, and so we prep for this, we drill for this. We ended up participating in a citywide, statewide mass casualty incident with drilling around active shooter. This was actually last October, and it was incredible participation. This went as flawlessly as what it could. I could not be more proud of the team. We have some surgeons who are former military, some who are still active duty military, who've been deployed in Afghanistan and in Iraq, and their comments around the level of engagement and how we were able to care for these patients was second to none.
How is it important to prepare for it, and then unfortunately it happens, but how does it help you when it happens?
It helps for us to be able to coordinate everything from making sure that the blood products and sterile supplies that we need for operative procedures, that we're able to have all of those and know what to do for massive transfusion, for multiple cases going on at the same time, and so that's what we prep for.
And then doctors being kind of for close by, or just on standby, right?
Yes, and as a level 2 trauma center, again, there's requirements that we have for in-house trauma teams, as well as folks that are on standby and on call.
Are you asking for blood donations?
Certainly, blood donations will be helpful.
Where?
I'm not entirely certain. I believe United Blood Services, and I don't know where else to necessarily go.
Were there any patients sent to other medical centers?
Yes.
Other than UMC?
I'm not aware.
Do you know if any other patients passed away here?
No, we were incredibly proud to say that all of the patients that have been brought to us with God's good grace are still alive.
Anything you'd like to say, maybe we didn't ask?
Anything you'd like to add?
No, thank you. Again, I could not be more proud of our team. This is truly a tragedy. And El Paso should be incredibly proud to have a system and a team that has been able to address this the way that we have. Again, with God's good grace, all of these patients will end up surviving, and I just couldn't be more proud.
What about family members? Can they come and ask for their?
We have had family members. There's a phone number 915-263-6999 for a patient hotline. We have been working to be able to identify patients and family members.
Is it just immediate family, or sometimes there's cousins, or family members? Could be.
Any family can be able to call.
Can you repeat the number, please?
915-263-6999.
Thank you.
Okay.
Anything else you want to say, Doctor?
What are you hearing from family members? What is it like in there right now?
I'm not certain. We've been really focused on making sure that we're taking care of the patients, and at that point, once we have the opportunity to be able to interact with the family, I'll know more. But again, our focus, our efforts have been on making sure that we are taking care of those injured. All right. Thank you all very, very much.
Anything you want to say? No?
How do you spell your name?
FLAHERTY.
All right. Thank you all very much.
Thank you.
Thank you.